Well, basically, the proposal to expand Medicare is going to have a negative effect on patients as well as on doctors and hospitals, and ironically, it's going to have a negative effect on the government. The proposal is to expand Medicare to people under age 65. The problem with this is Medicare is not a very good insurance plan. It's not as good an insurance plan as most people under age 65 have, either privately or through their employer. Medicare has annual maximums. Medicare does not cover dental benefits. Medicare, unless you buy an additional part, doesn't cover drug benefits. It doesn't cover dental benefits. So there are lots of limitations to Medicare as an insurance program that make it more expensive to the beneficiary than other kinds of insurance. It's also more expensive, ironically, to the government. The government pays for each Medicare beneficiary about $450 per month to cover the hospitalization part of Medicare. That comes from tax revenues. The government pays, for example, for the federal employee benefit plan, about $350 or $400 per month for the beneficiaries on the government side. So the government pays actually less per month per member for their employees than they do under Medicare. So it costs the government more to provide Medicare benefits. And finally, it's worse for the doctors and the hospitals because Medicare has very, very strict price controls that really haven't changed much over the last 15 or 20 years, as a result of which most doctors and hospitals lose money taking care of Medicare, which ironically then pushes the costs over onto the non-Medicare insurance companies to make up the difference. Otherwise, the doctors and hospitals would go out of business, or they would have to refuse to take care of Medicare patients. And as you know, doctors are increasingly refusing to take care of Medicare patients because they just can't afford to keep the doors open at the prices that Medicare is willing to pay. So there are lots of problems. Right now, of course, I mean, Mayo, we accept Medicare payments. The problem is, as I say, they really don't pay all the cost. They pay about 2/3 of the actual cost. This is not our profits or anything. This is talking about how much it actually costs when you pay the doctors, which we're all on salary, pay the doctors, pay the nurses, order the supplies, pay the rent or the upkeep on the buildings and so forth. We get back about 2/3 of what it actually costs us to provide those services. And it really is not sustainable. The only reason we stay in business is because we do make a small profit margin on our non-Medicare business, which then covers the losses on the Medicare side. But from a business proposition, it makes no sense whatsoever. The only reason we see the patients is because we feel it's our ethical and moral responsibility as medical professionals to do so. But the government, as the government pays less and less and less of the actual bill of caring for the patients that the government is purportedly insuring, it just makes it more and more difficult for us to continue with that proposition. Well, a better model would be to use the existing systems that we have. The federal employee benefit plan, for example, is a great model. It's a nationwide plan. You can't be excluded for a pre-existing condition. They cover dental, it covers drugs, it costs less than Medicare. It provides better benefits than Medicare. It costs less to the beneficiary, it costs less to the government, and it pays more to doctors and hospitals than Medicare. So it's better all the way around. The government could simply open up that program to everybody in the country, and we actually wouldn't even need then Medicare. We could put all the Medicare patients on that. It would be a much better program and would cost less money.